is Vanessa, and I'm really excited to share this presentation on well-being with you all. So to start off, we'll go with some definitions of what well-being is. So according to the World Health Organization, well-being is a positive state in which we should all strive to achieve. It is a positive rather than a neutral state, and it frames health as a positive aspiration in life. Well-being is the ultimate health goal. It is a resource for daily life. Well-being is hard to measure objectively. It is a diverse measure that encapsulates different dimensions of health. So what exactly are the dimensions of wellness? As you can see in the image that I've posted, there are so many different dimensions that are included. I'll go through all of them and give some examples of what they entail. So physical wellness relates to physical health and behavior change. So for instance, exercising and eating healthy food. But that's not all that well-being is. Intellectual wellness is learning and experiencing while growing as a person. Emotional wellness includes taking accountability for your feelings. Recreational wellness is maintaining social lives and relationships. Vocational wellness is finding meaning through careers, volunteering, and hobbies. Cultural wellness is a sense of belonging, acknowledgement, and respect to one's cultural background. Spiritual wellness refers to finding harmony and meaning in your life, whether that be through formal or informal spirituality. And then financial wellness refers to finding harmony in the expenses that you have and planning for your future. And finally, environmental wellness refers to one's environment and their sanitary conditions in which they're living in. So there are different ways of viewing well-being and mental health. One perspective is that well-being is distinct from mental health, where one with a mental health condition can achieve a high level of well-being if they're seeking treatment. Others prefer a single continuum model, where mental health is directly related to well-being. So next, we'll be talking more about the social determinants of health. As you can see in this image, the idea that individual change is shaped by broad determinants is showcased. So it's not just about making a change for yourself, such as healthy eating. All of your decisions are shaped by broad social determinants of health. So next, we will be, I would like you all to listen to Dr. Rishi Manchandra's clinical experience with his patient Veronica. So I'll be reading what he has to say about his patient Veronica. I met a young woman named Veronica. Veronica had recurrent headaches that were accompanied by fatigue. These symptoms were interfering with her activities of daily living. She had sought care for her symptoms in the emergency room, where she had worked up on multiple occasions with CAT scans, blood tests, and more. These tests did not reveal the cause of her symptoms, and she was given medication for pain and told to return if she didn't get better. But her headaches, they persisted. She began taking more sick days, and she felt like she wasn't doing enough for her children. That was when Veronica first presented to my clinic. When Veronica showed up, our medical assistant, using a screening tool to identify housing risk factors, discovered that she had mold in her home, water leaks, and roaches. This information was presented to me along with her vital signs and chief complaint. During my encounter with Veronica, I realized that she had chronic allergies and migraine headaches. Both were directly tied to her poor living conditions. I treated Veronica for her symptoms, but most importantly, I referred her to a community partner specializing in housing and health education. This organization sent a community health worker to her apartment. When Veronica came back 3 months later, her housing conditions were improved, and she was feeling much better. While working in South Los Angeles, I encountered situations like this virtually every day, and sometimes multiple times per day. I quickly realized that the traditional skills I learned in medical school weren't going to address many of these problems to their root, and I realized I would need a different approach. I looked to community stakeholders to identify the social and environmental conditions that I knew affected my patients' health, and I began training my team to screen patients for these problems. I also began compiling community resources such as housing support to help them. What we learned from this story is that health is often viewed from an innate biological lens. This is what is seen through the traditional biomedical model of health, where health is defined as the absence of disease or infirmary. So now we'll look at some examples of the social determinants of health. As you can see from some of the examples listed above, the social determinants of health are integrated into broader societal contexts. Consider the impacts this may have on our society. We reveal that the broad social policies have a profound impact on the health of a community. Consider a low-income neighborhood. Oftentimes, we might witness a rise in the amount of fast food services available, provided to residents, as opposed to farmers markets in those areas. Walkability in neighborhoods is another example. If a community one lives in is not safe to be out, and there aren't trails or parks nearby, residents will have a harder time maintaining physical activity for their physical and mental well-being. The environment one grows up in has profound impacts on their health later in life. We shape our well-being from the earliest moments of life. Early childhood experiences truly shape you. But as you can see, the broad social determinants of health are a factor that create health disparities in communities abroad and at home. Here we see the social ecological model of health, where in fact everything is connected. Individual behavior relies on broader public policies in place. Everything from the individual to the distal determinants are all interconnected. Public policies shape communities, which shape organizations and schools and workplaces, which shape interpersonal dimensions of health, such as your connections with family, friends, and your ability to create social networks. And all of that ties down to the individual. So instead of telling someone, oh, you should do some behavior change, we should look at the broader public policies in place and see if that person is able to truly change their behavior. Next, we will discuss the rat park study from the 1970s, where rats were separated into community and isolative settings, and were both given an option to drink morphine or alternatively drink pure water. The rats which lived in the rat park lived in highly social settings, and they preferred the plain water, while the rats that lived in isolation often chose to intake morphine at a higher rate. Our social connections truly have a profound impact on our lives. Maintaining social interactions reduced the want for medicated euphoria among rats. This study has been adapted to examine addictions in humans. The study also reveals the importance of social connectedness. Having a good social network is important for satisfaction, positive mental health, and achieving well-being in all aspects of well-being. As this study reveals, the interpersonal dimension of health is equally important to the other traditional physical dimensions, such as having visible lesions on your body. With social connection, we find purpose, we develop our personality, and we share ideas with others. Ultimately, we can find peace and happiness. Finally, I would like to end off by asking you all how you're remaining connected with extended loved ones and what your current hobbies are. So to answer this question myself, I like to connect with others by going on walks, communicating with my extended family online currently, and helping vulnerable groups, including the homeless and children located in the Global South. Communicating with others allows me to connect with my friends and learn more from them while sharing my own daily encounters. While studying at university, there would be times when I wouldn't really speak to anyone almost all day. And I wouldn't really realize it until I would realize that I haven't really spoken at all. I would just think in my mind and speak with myself in a way. So during those times, I truly felt the need for social connectedness. They say you never really appreciate something unless you experience the lack of it. During our busy times, it is especially important to communicate with others and take time out of your day to do that. This is exactly what the Positive Thinkers group is doing, and I applaud you all for recognizing how important interpersonal communication truly is. Thank you.